educative edition of the program brought Way to Health, an hour-long program brought to you by the Ministry of Health, of course, designed to educate, inform, and empower you about health-related matters. Well, today is Tuesday, the 23rd of December 2025, and driving you through this edition of the program are Angelina and
Melvin Stewart.
And of course, we have AB Salifia making sure that you get access to this program through the ministry's official Facebook page. So, however way you are joining us this morning, wherever you are joining us from, we'd like to say welcome. It's always good to be here with you. For those of you joining through the ministry's official Facebook page, I'd like to encourage you this morning to like and share the live stream. Invite a friend to watch along with you. And to our dedicated radio listeners, I'd like to say it's always good to be here with you. For this morning, we have invited in studio the Director of a Mental Health Unit at the Ministry of Health, Dr. Moses Yah II, who is set this morning to take us through the National Anti-Drug Action Plan that was recently launched by the Ministry of Health, of course, on December 18, 2025. I mean, this year, by the Ministry of Health. Dr. Zia will take us through the action plan this morning. Stick with us as we take a very short break to be back with details. Welcome back and thanks for rejoining us. Well, good morning, Melvin.
Good morning, and good morning to everyone.
Well, compliment of the season.
I wish you the same.
And for the local things, you already prepared for the season.
What do you mean?
Your appearance.
Oh, okay. God bless me so.
I can see how you tell that.
Yeah, just your headphone. You have to. Okay, it's okay now.
Okay.
Yeah.
Okay, so welcome our guest, Melvin.
Dr. Zia, I would like to say good morning.
Good morning, Melvin, and good morning to the people of Liberia.
Merry Christmas and Happy New Year.
Well, happy returns, of course. I hope that you get my Christmas before I leave.
I think are you getting Christmas? Anyway, it's good having you, and you always appear energetic, and I'm so proud of the work you do for Liberia.
Well, thank you. It's my pleasure.
Okay, tell us how. I know this is a normal question we always ask you. How is the mental health unit?
The mental health unit is doing well. I have a fantastic team, and they're there making sure that the unit is achieving its goals. So we're grateful that we keep doing our best and we're getting somewhere.
All right. And this is quite strictly associated with the recent launch of the National Anti-Drug Action Plan 2025-2030. It's a 5-year strategic plan under the Ministry of Health. Before we get into the nitty-gritty of this, the importance and all of that, why this plan was launched? In fact, what is it first?
Well, the anti-drug action plan, the National Anti-Drug Action Plan, is a multi-sectoral plan developed to guide the intervention, the national fight against drug and substance abuse, which has since been declared as a public health emergency by His Excellency. So this plan actually brings out all the interventions that are required to tackle drug in its totality. So the plan was clearly developed because it's multi-sectoral, so that means the development brought together all the actors, including government ministries and agencies, including civil society, development partners, community-based organizations, the youth representative, local government representatives, and so forth. So it is multi-sectorial, and it brought together all the major actors as it relates to the fight against drug abuse.
You launched it on the 18th of this month, and you say multi-sectoral. It has a conglomeration of different groups, ranging from the old, the young, and different people from different sectors. And tell us how did it go? How was that a process? And what did you expect prior to the official setup date before you can have it launched?
Well, it has been a long process. Every time you want to develop a strategic plan or a policy document, you have a lot of consultations to do. So, since 2024 January, when the president set up the committee, we've been working, incorporating other people who were not announced by the president, but whose works are crucial to the process of fighting drugs in Liberia. So, the Honorable Minister of Health, and by the way, good morning and compliments of the season to the Honorable Minister of Health, Dr. Louis Poto, and the entire senior management at the Ministry of Health, but also to the entire multi-sectoral steering committee on drug and substance abuse. So when the president announced the smaller committee, the team headed by the Minister of Health realized that there were a lot of major players who needed to be involved. And so the membership was expanded. That was one of the first actions taken by the committee. So a lot of other agencies, including Ministry of Education, Ministry of Internal Affairs, Ministry of Information, a lot of other agencies that were not originally announced were brought on board, including the development partners like the One UN, civil society, and so forth. So when we started meeting, and by the way, we have different levels of leadership. We have the steering committee, which is mostly the head of agencies, but then we'll have a technical working group, which is made of technicians. So those technicians came together from all these entities, and we started the process of developing a plan. So a plan is mostly about what do we want to do.
Yeah.
So bringing the different expertise from law enforcement, from health, from gender, from social services, and so forth, we started to draft what we thought would be needed to fight drugs. So it was a long process. We consulted a lot. In from January 2024, we launched in December 2025. So it's about 2 year period. We didn't just put out the plan or the activities we want to do. We brought in financial experts, our colleagues from Ministry of Finance, our colleagues from other agencies who are health financing experts. They sat with us and they tried to budget what it would cost to implement the plan. So it is not just a strategic plan, but it's a fully costed strategic plan looking at minimum resource requirement.
Okay, Dr. Zia, I would like for us to talk a little about where we stand as a country when it comes to the fight against substance abuse. And then, it can drive us to what actually motivated this plan.
Okay, so as a country, we started off with the statistics in mind about how big the problem is. So we have estimate data around that projects that about 20% of the youth in Liberia are abusing drugs. And that was a 2022 survey, a 2022 study done by the UNFPA. So if 20% of the young people in Liberia are abusing drugs, you want to know what is the overall percentage of the young people. And so the census, the 2022 census also says that 75% of the people in Liberia are 35 and below, meaning they are 25 years old and below. That means we're talking about 75% of the country, and then about 20% of that number has been projected to be using drug thereabout. So that is a big problem. All right. So if this is a problem, then we need to do something about it. So we also see that there are multiple factors that contribute towards drug abuse. It's not just people wanting to use drug, but there are other things that drive the drug abuse. So the issue about poverty, the issue about unemployment, the issue about mental health challenges and trauma, but also the easy accessibility of the drug is another factor. So all of these factors put together are the drivers of drug abuse. So if this is the situation, then you see that we're in a big problem. And so if the president, as he did, comes out to say this is a public health emergency, that means we all really, really got to put on our boots and we got to keep moving. Also, I like to emphasize, and I always do this, that drug abuse is not just a behavior, it's a brain disease. And because it is a brain disease, the Ministry of Health has the cardinal responsibility to lead the treatment aspect, whereas our other colleagues who are supposed to control the supply side are doing their work. So the second part of what you asked is what drove, the need for this action plan. So if there's any intervention in this case, there's a national response. You need a well comprehensive and coordinated plan that will guide your intervention. You need a roadmap that will guide the intervention. So the plan became quite important because we have multiple agencies working to fight drugs, and until we can clearly delineate the roles and responsibilities as well as the actions from each entity, it becomes chaotic, because many entities are involved. So this plan is a comprehensive roadmap that clearly tells us what agency is supposed to do what and what will be the outcome when this is done. So the plan became really important. But there are a few justifications we also try to pull out why we need a plan. First thing, drug abuse affects the entire country in multiple ways. It affects what we call human capital. It means if people are not going to school, they're not able to get a career, they're not able to work, their unemployment rate becomes still high, and then the country suffers, right? Productivity goes really low. Also, if you have a lot of people abusing drug and they have drug use disorder, clearly speaking, there are a lot of money you need to treat people. So the health cost goes up. So we're already a small country. We don't have a lot of money, right? And then you have us spending so much money on health costs to cover HIV, TB, hepatitis, and all the other infectious diseases associated with people who are using drugs. So health costs goes up. But beyond that, also, the criminal rate goes up. And then there's a serious burden on the criminal justice system where you keep arresting people, putting them in jail, people stealing, armed robbery, and all those things go up. So clearly, there's an increased strain or burden on the legal system or the criminal justice system, which costs a lot of money also. But then at the end of the day, you see that the nucleus of the society, which is the family, is also badly affected. So it's integrated. So you have parents having struggles with their children, or those ones who are abusing drugs who themselves start to father or mother children. They start bringing children and they will neglect those children. And then you see like a whole cycle of people being poor, uneducated, and then it becomes a burden. The final justification we'd like to highlight is the fact that when you invest in treating drugs, you also have a massive return on investment, as we call it, return on investment. If you do not do anything about it, the amount of money that you will be using from healthcare costs as well as criminal justice costs, it will be so high, and at the end of the day, productivity keeps going low for the country. But if you're able to invest, you are able to get a lot of return, meaning benefits in fighting drugs. So, for example, the WHO say when you invest in good prevention methods, you are able to get every $1 you invest, you are able to get $10 in return on investment. That is 1,000%, for example, that you will get back if you invest in investment. I mean, you invest in prevention. And if you invest in treatment, you are able to get around $4 to $7 for every $1 you get. So you see that it is actually the good thing for us to invest in fighting drugs because the overall gain that come back to us will be a lot. And by investing in drug fight, we are able to achieve some of the sustainable development goals. The issue about good health and well-being, the issue about quality education, the issue about decent work and economic growth, as well as the issue about justice and strong institutions. So those are the reasons that we thought we need the plan to guide our fight.
Okay, so let's get into the plan, Melvin.
Yes.
What's actually in the action plan?
Okay, so the anti-drug action plan is built on three pillars. We have the first pillar, which is drug demand reduction. It means that we should reduce the number of people who want to take this drug. The number of people who will buy this drug, we should reduce that number. So that is the first pillar, right? Drug demand reduction. That pillar has two priority areas. The first priority area is prevention and education. So we want to conduct school-based prevention programs to educate our young people about the danger of drug abuse so that they cannot be tempted to use drug. All right? We want to, in that regard, some of the activities, for example, we want to incorporate drug prevention manuals into our schools so all the young people can understand that drug is dangerous for their health and so that they can try it. We also want to do community-based prevention work. We want to work with young people in the community. We want to work with families. So that whole prevention and education, we want to do public education. It is all about educating people so that they do not use drug. And if they know the dangers associated with drug use, they will not do it. That is the first priority area. And when you do that and you achieve a lot because you spend little money, but you are able to have greater impact. The fact that people will not be buying the drug. If people are not buying drug to use it, then the drug dealer goes out of business, for example. So we try to do a lot with drug demand reduction. The second priority area there is that one of that pillar is the fact that there are people who already have people who are already using drug now. They have drug use disorders, which we call drug addiction, right? They are now addicted to drug. We need to treat those people. Some of them, we need to treat them. We need to treat other medical conditions that they have developed because of the drug. We need to treat things like overdose, So generally, we say treatment, rehabilitation, harm reduction, as well as social reintegration. Now, when you treat people, you need to put them back into the community so that they become useful citizens.
You got the reintegration.
Right, social reintegration, which is another very cardinal part. So priority area 2 is focused on that. Then we will go to the second strategic pillar, which talks about drug supply reduction. So the first one I said was drug demand reduction, right? The second strategic pillar is drug supply reduction. So under drug supply reduction, there are a number of priority areas. The very first one is called law enforcement and control. What our LDEA and security personnel are doing is law enforcement and control. We want to make sure to target anyone who wants to bring drug in this country, anyone who wants to deal or traffic or trade drug. We need to make sure we target them so that they don't have any market, they don't have anywhere to come and bring drugs. So we don't want drug to enter our country from anywhere. Then second, we don't want people to open some labs. They have all these illegal laboratories that they are able to open in the country. They will not bring the actual drug, but they will bring what we call precursors, those chemicals that you can combine to make the drug. There are other countries now they're doing it. So we want to be able to prevent people from making drug in our country, as well as prevent people from importing drug. That is the goal of supply reduction generally. And law enforcement and control is to target those people who want to do it so that we can put them, beyond bars. That's the essence. So the second priority area in that place is what we call control and regulation of medical controlled substances. So there are medications we use in the hospital that have the potential of being abused. They are used for different medical purposes. But if you don't control them very well, they leak out there and people start to abuse them. An example of that is tramadol. You hear about tramadol all over the place. Tramadol is a medication that we use to treat pain in the hospital. But it is under a category called opioid. Now, if you don't control tramadol use, people can become addicted to tramadol. Diazepam, for example, which is a benzodiazepine, a class of drug, many of them, they are useful in medical setting, but when you don't control them tightly, they can become abused and people can be addicted to it. And some of them can even be way more dangerous than some of the things we know. So in that way, we want to be able to tightly control those medications, require pharmacists to give them out based on prescription, make sure that they are tightly controlled. That's the second priority area. Then the third priority area in that line will be what we call legal and judicial reforms. We want to review all our drug law national and international laws that have to do with controlling illicit substances. What is it in our law that we want to change? What do we want to modify? So we want to, over the next 5 years, be able to review, maybe in the first or second year, review our laws to make decision whether there's a need to change anything. So that's legal and judicial reform. That's the fifth priority area, right? Then the final strategic pillar, which is strategic pillar 3, is governance and coordination broadly. So governance, coordination, and evidence for decision making. So there are two priority areas here. The first one has to do with governance and coordination. When you have multiple entities working together to achieve a single goal, you need to really coordinate properly. If you don't coordinate, you fail. All right. So we have a specific priority area responsible to coordinate the fight. And under this priority area, we have clearly outlined levels of leadership to ensure that things are going properly. From national level to the community level, we want leadership, we want people to take charge, right? So the highest level of leadership is the multi-sectoral steering committee. So the steering committee is made of the ministers or the heads of agencies and the principal deputies, all right? So they are the final decision makers. So when they understand what is going on, they get all the facts, then they choose the direction the country should go in. They are the final decision makers. They're where our bosses sit. Then the second level of leadership is what we call the technical working group, which is the National Technical Working Group on Drugs and Substance Abuse, right? That committee is the one that I head. That committee is responsible to design interventions and present it to the steering committee for decision. And when the steering committee approves, that technical working group rather is responsible to implement. All right, providing overall national leadership on the technical side of things. So the next level is what we call the county anti-drug committee. We want every county to have anti-drug committees, and that is more like the sub-national level of the technical working group. The county anti-drug committees will be made of technicians also, from health to security to gender and all of that. They will be responsible to design intervention at the county level in line with national and be able to lead implementation at the county level. Then the final level of leadership we have is what we call the community anti-drug action team. We want the county to work through the district and the community to ensure that every single community is building a team, a committee or a team by themselves rather, to ensure that the fight against drug abuse is not just government thing. It is our own thing at the community level. So who are the people that should be on the community team? We talk about the community leadership, maybe community chairman. We talk about local government representative, maybe township commissioners, city mayors, and so forth. We talk about the county health, the youth representative, the women representative, traditional leadership or religious leaders. So we want a cross section of people at the community level from different backgrounds who will help to fight drug at the community level. If you remember the president in his release in August 2025, he made a case that this fight against drug abuse should be a whole of society. And he mentioned that we should involve the community. So the community will be involved, the leadership from young to old, women, men, elders, everybody should be involved. They know who sells drugs, they know where drug dealing activities happen, and so forth. So they will play that crucial role. Then finally, for the last priority area, is about monitoring, evaluation, and research.
There where I wanted to come in.
Right. So every time you design an intervention and you want to implement something, you should be able to sit back and review what you are doing. Is it being done properly? Are there areas for improvement and so forth? So monitoring and evaluation will constitute that routine assessment of what we are doing to know whether we're getting the result, what areas need to be modified and so forth. But then the other part which has to do with research is about us evaluating the data to know what is working, what is not working, what is changing, what is not changing, what new information we're getting based on what's happening in the country, and how can we modify our interventions. So in a nutshell, that is the plan.
I see a whole line of holistic approach, owing to the fact that the president has his hand right on this fight against drugs, and you have the Minister of Justice, Councillor Oscar Tue as well, backing it up from the angle of the Minister of Health. But my concern is because you spoke of the LDA officers. I've been propping the system up to work with community peoples and all of that, especially to those border points, because those are places that the drugs normally pass and enter into the larger cities. Now, my concern is how you think this will work in the midst of challenges. I know you've not mentioned some of the challenges that are on the way, but looking at the way the borders are poorer, and LDA officers will need logistics, they will need all the support. The Minister of Health alone cannot do it all. How are you envisaging for operative approach in terms of budgetary allocation?
Okay, so I think there are two concerns there. How do we intend to implement, considering the challenges, and how do we expect to get funded, right?
Yeah.
So let me answer the first question. This is a plan that has been designed to guide us on what we want to do. If you go to the strategic plan document, there's an annex at the back of it. And that annex talks about the several activities we have enlisted to do. All right, there are multiple annexes. One of the, I think Annex 1, either Annex 1 or 2, talks about the different activities we want to do. So when you talk about the challenges, yes, LDEA struggles with porous border, with lack of equipment at the borders to be able to scan. Now imagine somebody is bringing goods in a very big truck, right? If that person is intentional about bringing drugs, they might put that drug in the middle of or at the bottom of that whole consignment of things they're bringing. How do we tell that drug is in this thing, in this big truck? You need equipment, right? You need technology. So when you look at that action plan, we are very intentional to have scanners, technologies like scanners, like drones, and other apparatus that you will need to detect that drug is somewhere. Additionally, one of the things that we intend to do there is to start what we call the K9 unit. The K9 unit is a kind of security system that requires animals, dogs in particular, these sniffing dogs. They are so trained to the point that they are able to smell anything and tell whether drug is in it. So as part of this plan, the LDEA intends to establish a K9 unit, starting with a number of dogs first.
Wow.
So
It's a new system.
For Liberia, yes, we've
yes.
not had it before.
Yeah.
We've not had it before, but it is clearly a part of this plan. So they want to get some dogs in to parade the port, like the airport. You know, if you go to other countries, by the time you get down and you're supposed to pass through security, they ask you to put your luggage down. And then you pass on the other side, the dog will come and sniff. And if there's any drug there, it's going to find it. So we want to bring that, for example. It's one of the clear plans the LDA has. Then we talk about scanners, right? So there are all these equipment or these technological, advancements that the world has made that you are able to just scan different things and you're able to tell whether drug is in there or not. Currently, we do not have those things in our port of entry. So those are areas we want to work. When you talk about porous borders, I understand we have over 100 plus borders in Liberia, but there's only around between 40 45 of them that are men, where we have people. So as part of this plan, the LDA wants to expand coverage at the other borders that don't have, LDA officers. Those are part of the plans we have made. All right. So clearly, we have a lot of the things we want to do to tackle current challenges. Now, one of the challenges will be on the side of Ministry of Health, for example, the country does not have rehabilitation center, public rehabilitation centers. Now we are partnering with private providers, NGOs, and other people to provide care. Recently, we opened a rehab center. We had to transition into a rehab center in Johnsonville, the El Chupa RC facility. We had to do it because we had an emergency and we needed to make a quick decision. As we speak, as part of that plan, the government intends to expand facilities for treatment. In early next year, we have a facility in Johnsonville, the YATC, we have two big dormitories that we are renovating. In the processes, the renovation work will be done in few weeks. We'll be able to enroll close to 400 people in treatment, for example. So that is a current challenge that we are faced with. But these are things that we want to do. And when you look in a plan, you see clearly that we want to expand treatment services. Beyond expanding treatment services through infrastructure, we want to be able to work with private providers. Now, but we want to ensure that those private providers are doing the right thing. We already started working with them to train them and make sure that they are doing what they're supposed to do. They are providing services. In the plan, we intend to provide what we call accreditation checklist to decide that this center is doing the right thing, this center is not doing the right thing, so we'll close this center down. Those are some of the interventions we want to do to solve some of the challenges we are having. And by that, working with private providers, we want to work with them on the side of prevention. There are a lot of NGOs, a lot of individuals who've been doing a lot already fighting drugs. In this plan, we've clearly enlisted what we call a grant system, where you can give them some little funding as a government so that they can do some of the work that you want to do as a government. All you need to do is to ensure that they're doing the right thing. So those are all things we want to do, and we'll be working with civil society, community-based organizations, and so forth.
Let me ask. I'm curious about the K9 program.
Absolutely, I agree 100%. So what I've been told, and by the way, I've asked a lot of questions around from different people, hearing from different people what it is. What I'm told is that the LDEA will initially bring some dogs in along with the go through that training for around 18 months. So that's just something around 2 years, right? So we will not wait. This is a 5-year plan. Yeah. We're not going to buy brand new puppies now and start training them for 2 years before we start working. So the idea is to bring some dogs in.
The veteran dogs.
Yes, bring some of them in along with the trainers. Then we start breeding dogs so that we can expand the number. But to maintain these dogs are expensive dogs. They're security guards.
Will you be paying them? Because in other countries they pay these dogs for the work they do.
The way you pay them is to care for them, them, their health, their feeding and everything. Those are rich dogs, actually.
And then before Angela comes in, before we open the lines, let's look at this dog, and because it's a sensitive issue, because those that I mean, they always like killing these dogs. It's a hint to them now to stop eating dogs around the place, because we need to take care of we need to train them.
Yeah, that's right. But the other part of the question you asked, which I didn't respond to, is the resource part. Mm-hmm. This is very important. In this plan, we have provided, and the fact that it is being launched, it becomes now a policy issue, right? Mm-hmm. We want to establish what we call the National Drug Rehabilitation Fund. The National Drug Rehabilitation Fund is more like like you have the National Road Fund, for example, right? It's like a pool fund wherein you put resources to be able to fight drugs. That's what we already put here. Mm-hmm. So where do we expect to get money from to fight drugs using this model? We expect budgetary support from national government. All right. We expect partners and donors funding and support. We expect what we call tax levies taken from other substances that can cause problem for us, including alcohol, including tobacco products. You take some taxes from them, and those taxes can be used to treat, diseases that those products can cause. So usually, some of the money will go to the Ministry of Health, for example, what we call the NCD, which is the Non-Communicable Diseases Department, to treat other conditions, the heart diseases, the high blood pressure, and so forth. But also, we are requesting that some of those monies can come to the fight against drugs. So we call them sin taxes, all right? Those monies will also help. Additionally, we expect that if private partners, private individuals want to fight drugs and say, I want to contribute to the fight against drugs, they should be able to contribute directly to that National Drug Rehabilitation Fund, and that money can be used. We have a lot of concession companies, many of the big companies in country. They have what we call corporate social responsibilities. we expect that some of them will be able to contribute to the fight against drug by putting money in this National Drug Rehabilitation Fund. Also, the president said it is in our current drug law that when we seize properties belonging to drug dealers, once they've been convicted, we should be able to sell those properties and get money out of it. Those money should be used to fight drug.
Yeah.
All right. So some of it will be used for supply reduction by the LDA, but some of them will be used also for treating people who have drug use disorder, and so forth. And then we'll have what we call the private or public-private partnership. There are organizations that we can work with, and they can bring some resources to the table for us to fight drugs. So these are the areas we are expecting to get money from. So you see that it is not 100% reliant on government budget. All citizens, private citizens, can choose to donate to the fight against drug abuse.
Well, at Zia, do we have an existing, law or policies that actually guide this plan?
Well, this plan is a strategic plan,
Okay.
and a strategic plan document is a policy document that guides implementation. So this is clearly the roadmap to what we want to do as a country, and this document in itself is enough. As you can see on the first page there, if you flip through, you have a presidential endorsement.
Yeah.
The president has signed this plan. You see that? The president has signed this plan. So this is a presidential endorsement. And if that is the case, it means that the highest political will has been acquired. So this document is very powerful. I can assure you that it's very powerful. And this is the document that's going to guide us over the next 5 years on how we're going to fight drug as a country.
So what positive change should citizens expect, if the plan is successfully implemented?
We should be looking towards a drug-free Liberia. That's the vision. We want a safe and drug-free Liberia. Drug comes with a lot of problems. Crime is one of the biggest outcome of drug, or serious drug crisis. So we want a safe Liberia and a drug-free Liberia. That is the vision. So we don't want the citizens to expect. We want the citizens to work towards achieving this free and drug-free, safe and drug-free Liberia. I have said it repeatedly that this plan is built around the community. It requires everybody to be a part, not just the government, not just government entities. So 12 houses. If you as a resident of 12 houses make sure through your support to this plan that no drug dealer lives or carry out drug selling activity in 12 houses, it means no drug will be in 12 houses.
Okay.
I live on an old road. As a citizen of old road, if I do the same, no drug will be on the old road, right? In every community standing up to this will ensure that we do not have drug in Liberia.
Lastly, Dr. Zia, before we open the phone lines, we're talking more about communities, participation in the implementation of this plan. And I'm concerned about how community dwellers can report these issues when you take into consideration their safety, because sometimes you will see people going after them if they are reporting. How can they safely report and still be protected by this plan?
Okay, this is very good. A great question. So in that plan, we have something called a whistleblower system. Whistleblowing means you don't need to tell everybody that you're going to report somebody. You take your phone quietly wherever you are and you report suspicious activity. Like somewhere, many of us, and I always say this, many of us know people who selling drug in our communities, and we can be passing and say, no one who they selling drug. What we forget to know is that those people are chasing money, but they are destroying our country. They are destroying our children. So if you know of anyone or in any vicinity where drug activity is and there's a suspected dealer in that place, you can quietly take your phone wherever you are and call the LDEA. All right? And say, oh, this XYZ is going on. That is intelligence. The LDEA will use that information. They will confirm. They will verify. They will do intelligence visit, to find out whether what you're saying is true. And once it is true, they come and get rid of that person. So you can be safe that you take your phone wherever you are and make a call. Nobody knows who you're calling. So we have this whistleblower system clearly that we're going to develop. Now, as part of that whistleblower system, we want to have little compensation for people who are reporting, drug crimes. So if you reported, you gave intelligence and the LDA went through that and found out that this person is dealing and they arrest the person, we should have some little compensation for you to encourage more people to do it. And in that way, everything will be done in a security manner where you are protected. Okay. Nobody knows that, today I got $20 because I sent, I got somebody arrested. No, it's going to be private and confidential.
Do you have a hotline for that?
Yes, currently the LDA has some hotlines. We can just try to find it and send it to you. The LDA has hotline when you want to report drug crime related issues. But if you want to report, or let's say you want to reach out for help or to seek treatment, currently we have some numbers. But we are working on a toll-free line. A toll-free line is wherein you dial short codes free of charge. You're able to reach out. That toll-free line, we're in the process of developing it. There are some processes that we require. It's been a while now, but we're working with the Liberia Telecommunication Authority to be able to get that toll-free. But we can, at this point, announce the numbers. Or Angeline, you can announce the numbers later, the numbers that you can reach out to when you need to send somebody to treatment or when yourself want to seek treatment on the side of Ministry of Health. But the LDA has numbers also that you can reach out to report drug crimes.
Okay, we'll definitely get those numbers. So if you just join us, you're listening to Roadway to Health, an hour-long program brought to you by the Ministry of Health. And this morning we are in talks with Dr. Moses Zia II, the Director of Mental Health Unit at the Ministry of Health. As some of you may or may not be aware, December 18, 2025, the Ministry of Health launched the National Anti-Drug Action Plan, the 2025 to 2030 Action Plan. And we are here this morning talking more about the Action Plan. To be a part of this discussion, you can call us on 088-0514-096, 088-0514-096, 0775 677-376, 0775-677-376. So let's take our first call.
In 15 seconds, we don't have time.
Okay, I'm Emmanuel DM, calling from Pueblo. Dr. Diab, good morning. I want to advise that if we want to be successful, even the community leader, all of them should be involved into this. You are meeting with them. The town chiefs, you should have meeting with them. We will do this thing. Everybody involved, I think we should not be afraid that we will call the politician we happy. When everybody is involved, the town chiefs, the community leaders and their leaders and all the others are involved, will be successful.
Thank you.
Good morning.
Yeah, good morning.
Your name and where do you join us from?
Yes, my name is Prince Timon, calling from Boro Shara.
Go ahead, quick.
I just want to pass the information out because it has happened so many times where the DA do not perform most mature. After you provide them the information, they go out and tell those that they read and say, oh yes, it's that guy that gave us the information. So that has caused a lot of people to be in fear to provide more information. But actually, the DA need to be very mature in keeping whistleblower safe.
Okay.
All right. Thank you, sir. No time.
Good morning.
Yeah, good morning.
Yeah, your name and where do you join us from?
My name is Prince Timon, calling from GF0.
Go ahead quickly.
My concern is this issue about drugs to minimize all the ravages of youth. But often, I normally see in PA or the LDA going after the users. What happens to the inputter?
All right.
They are the main people.
Okay. Sir, you made your point. I think let us speak to that quickly, to the few concerns.
Okay, so the first one has to do with everybody being involved. Yes, this is further reinforced in this plan. And I said that the community leadership, including traditional leaders, meaning town chief, clan chief, whoever, they're supposed to put themselves together as a community anti-drug team. All right, a community anti-drug action team. So clearly, we are considerate of that. And we hope that every community will do this. By the way, after we're launching now, we're on the radio, we're going to visit different counties to work with the county teams to constitute the county anti-drug teams. and they now will have the mandate to work with the communities to be able to have these teams established. So this is something we want to get at the bottom of at the community level. Next, whistleblower exposure. Again, there are people who can be unprofessional in any entity, but I can assure you that the current leadership, from everything we've seen and from everything they've proven, they're trying to shake the LDEA up to maintain professionalism. So they've been dismissing some other agents and so forth, and they've been doing their best to improve the service. But clearly, there's no way you're supposed to expose a whistleblower. That is completely unethical. It is dangerous, and I know the LDEA does not tolerate that. Again, they are rogue agents, and when they are found, I know the LDEA takes drastic action against them. The other aspect about users being targeted. So let me make this clear, and this is one of the most contentious points that people keep bringing up, right? The fight against drug is holistic. In the Liberian law, the possession and use of an illicit substance is a crime. So if you are caught with one joint of weed or cannabis, you are a criminal because you have been seen possessing or using an illicit drug. It is a crime. So we shouldn't say the LDA should not arrest users. Users in Liberian law are criminals. However, we have made it clear that users have a disorder, they have a disease. If they are addicted, they have a disease. So what we have to do is when we catch them, we try to find a means through which they can seek treatment. And this plan also includes something we call alternative to incarceration. It means that when we catch you and you are a user and we know that you have drug use disorder, you are a criminal at that point, right? But when we take you to the criminal justice system, the judge should be able to decide for you and ask you if you want to go into treatment or you want to go to jail. If you want to go to treatment, then you come to treatment now as a client seeking treatment. But we need to put all the laws in place so that when they arrest them and carry them to the court, and the court asks them, they will not say, I won't go to treatment, but next moment when you release them to treatment, then they run away.
Okay.
So there's a whole section here that talks about alternative to incarceration, and that is something that is international and we want to do it. But the LDEA is right to arrest users, because when they arrest users, they interrogate them and the users can give up the dealers sometimes. So it's a whole trade. So that's the security job. We shouldn't say that we shouldn't do it.
Thank you, Dr. Zia. We
So
don't have time.
just quickly give us your parting comment. What should citizens remember about this as we close?
Okay, thank you. I think citizens should know that the government of Liberia is very intentional about fighting drug, and the multi-sectoral committee on drug and substance abuse has produced this 5-year plan that is supposed to guide our entire intervention. This plan is multi-sectoral, it is comprehensive, and it is evidence-based. We use all the existing evidence around the world that will help us fight drug the best way we know possible.
Okay.
So I say thank you to everyone who helped in producing this plan, and thank you to the leadership of the Multi-Sectoral Committee on Drug and Substance Abuse, the Honorable Chair, Dr. Louis Nkoto, and the Co-Chair, Councillor N. Oswald, and everyone who participated. Thank you.
Thank you.
Okay, government is very intentional about fighting drug, and the plan is here to make sure of that. With that, this is how I would like to leave you on today's edition of the program Roadway to Health. Many thanks to our guest, Dr. Zia, for sharing such valuable insights this morning. And thanks to you, our listener, for playing your listening role. We have been your host this morning, Angelina Noah and
Melvin Stewart.
And A.B. Salif has been here. Melvin, tell us from ELBC angle, please.
Emmanuel C. George.
Okay, until next Tuesday, have a good day.